Hello friends, myself Dr. J.K. Singh, MD Internal Medicine, and today we discuss about pedal edema, its causes, symptoms and treatment. Before understanding pedal edema, let's see what is edema. Edema is the swelling of the body parts from injury or inflammation. It can affect a small area or the whole body and can be caused by drugs, pregnancy, infection, etc. Edema occurs when the tissue swells due to the leakage of fluid from blood vessels, small blood vessels into the nearby tissues. Now let us discuss in detail what pedal edema is. So pedal edema is a swelling of the feet and ankles caused by abnormal buildup of fluid in the ankles, feet, and lower legs. Majority of the time, minor occurrences of pedal edema are caused by a fluid buildup known as edema. Edema of the foot can be caused by two different mechanisms and can happen in unison or separately. Pedal edema is a condition in which the feet and legs expand due to standing or sitting in the same posture for an extended period. If the edema in your feet is caused by a medical condition, it is critical to address that tissue to relieve the edema. Moving on to the causes of pedal edema, there are several factors that cause swelling in the feet, knees, and ankles. In most cases, lifestyle is the main reason for swelling, such as being overweight. Excess body mass can cause fluid accumulation in the feet, legs, and ankles due to reduced blood circulation. Standing or sitting for long periods can also cause edema. The muscles are unable to blood, pump bodily fluids toward the heart while they are inactive. The buildup of water and blood in the legs can induce swelling. On the other hand, edema can be an indication of a more serious underlying medical issue in some circumstances. Edema can be caused by a variety of diseases and conditions, including a blood clot in the leg. When certain components of your blood thicken and form a semi solid mass, blood clots develop. This process can be triggered by an injury, but it can also happen inside blood vessels that aren't damaged. When a blood clot develops in a vein in the leg, it can disrupt blood flow, resulting in swelling and pain. Another cause is injury or infection, which causes the blood to hypercoagulate so that the lower limb swells excessively. And another cause are venous insufficiency. When the leg veins or blood vessels are weakened or damaged in chronic venous insufficiency, and the veins obstruct the flow of blood back to the heart, causing blood to pool in the legs and resulting in swelling. Preeclampsia is another cause. During pregnancy, this disease causes elevated blood pressure. If the blood pressure is too high, it can lead to impaired circulation and swelling in the legs, face, and hands. And one more important cause of pedal edema is cirrhosis, in which there is a scarring of the liver induced by alcohol consumption or infection. In this condition, the production of protein is hampered, which causes impaired circulation in the feet, legs, and ankles. And one more important cause of pedal edema is, of course, congestive heart failure, in which one or both of the lower chamber of the heart lose their capacity to effectively pump blood, and blood could back up in the legs, ankles, and feet as a result, causing edema. Kidney disease is one of the important causes of edema, and it also causes anasarca. Edema can occur when there is too much fluid and salt in the bloodstream due to renal failure. Edema caused by renal disease mainly affects the dependent parts, that is legs. Inadequate lymphatic system is another cause to another cause for pedal edema. The lymphatic system of the body aids in the removal of excessive fluid from the tissue. If the system is compromised, such as by cancer, surgery, the lymph nodes and lymph vessels that drain an area may not function properly, resulting in edema. Severe and long-term protein deficiency is also another cause for edema. If the diet is deficient in protein for a long period, it can lead to fluid accumulation and results in edema. So, how do we identify pedal edema? Let's discuss this. How do we identify? The symptoms are swelling or puffiness of the tissue just beneath the skin that is stretched or shiny, the skin that retains dimple after being pressed for several seconds, say for 30 seconds. Moving on to the treatment of pedal edema. First of all, we have to identify the cause of pedal edema, and then we will have to treat the same factor for which is responsible for the pedal edema. So, mild edema normally goes away on its own, especially the affected limb is elevated above the heart. When we raise the affected limb above the heart. More severe edema, on the other hand, can be treated with medication that assist your body remove extra fluid through urine. However, based on the patient's medical history, the doctor will assess if these drugs are an appropriate fit. Treatment of the underlying cause, as we already discussed, treatment of the underlying cause uh, is usually the focus of long-term therapy. If edema develops as a result of medication use, the doctor may change the prescription or look for a different medicine that doesn't induce edema. The following lifestyle changes or home remedies may aid in reducing edema and preventing it from returning. Movement is must using the muscles in the edema affected area of your body, particularly your legs, can assist in pumping the excess fluid back through your heart. So ask your doctor about activities that might help you to minimize edema. Elevation is also important technique. When we elevate the affected limb above the level of heart, then it will also help in reducing the edema of affected limb. And massage, we can massage the affected area with firm but not painful pressure towards the heart. It will help in moving the extra fluid out of that location. And compression, yes, compression is, if we apply compression of the affected limb, then it will pump the extra fluid through lymphatics or venous system, and it will remove the extra fluid and help in relieving the edema. And last but not least, reducing the salt intake is also a very important factor in reducing the edema. So we have to restrict the salt intake according to our body needs, and it should be kept at minimum levels. And when you visit your doctor, then ensure to ask your doctor that what are the possible causes of my symptoms, what treatment options are available. If I have other medical problems, will this treatment interfere with them? So, lastly, I would like to suggest that reducing salt consumption and doing some daily activity can reduce the formation of edema. It is important to consult a physician if you see any signs and symptoms of edema. to avoid further complication like difficulty in walking, stiffness, pain, and decreased blood supply. Thank you, friends. I hope you will understand the basic topic of edema and you will have some clear concept regarding this. Thank you.